confirmed cases to 4,332. There are over 1,800 active cases with 102 in hospital. But the second wave of COVID cases in the Bahamas is impacting more younger people than the first wave, according to Chief Medical Officer Dr. Pearl McMillan. With over 4,300 confirmed cases, the Chief Medical Officer says New Providence continues to see a consistent high number of confirmed cases on a daily basis, recording 88 just yesterday. However, she said it appears young people are not transmitting the virus to the elderly in the family.
Here, we see that our data continues to show that the second wave is impacting a younger age range than the first. This observation also suggests that household spread is not occurring. Instead, it suggests that workplace spread may be the prominent factor for the spread of this disease during this second wave.
96 people have died from the virus in the country so far, with 16 deaths still pending. Dr. McMillan says health officials since the start have been concerned about the elderly, as their age group is more likely to die from complications from COVID. But she says the numbers are finally trending in the right direction.
It is clear that our collective efforts to reduce the spread of this virus to older members of the population appear to be successful, and we should all be commended for the job that has been well done.
Well, the National Reference Lab is looking into validating saliva testing for COVID-19. Health Minister Ronald Wells yesterday explained that because of its less invasive and a far easier process, it's something government is looking to try.
The laboratory is also working feverishly to validate saliva testing for COVID-19. COVID-19 saliva testing is extraction-free technology, which speeds up the process to achieve accurate COVID-19 test results. Saliva testing simplifies sample collection. It is cost-effective and less uncomfortable and less intimidating for the patient.
As the country continues its slow reopening of the economy, Consultant Physician Staff Association President Dr. Sabrina Pinda-Butler says there is still concern surrounding the number of positive COVID-19 cases being reported by the Ministry of Health. This week, the Bahamas surpassed 4,300 cases and pushed the total death toll to almost 100.
We have seen where there has been a decrease in numbers, and then some days the numbers have shot up significantly. Certainly, we expect that the Ministry of Health, as well, contact tracing and all those persons that are intimately involved with recording numbers, are following due process and ensuring that numbers are not duplicated. We're not counting repeat testers in those numbers as well.
Health officials have noticed a fluctuation in the number of cases on a day-to-day basis, with some days in the triple digits and some days not as much. Dr. Pinda-Butler says a close eye needs to be placed on each person, lab, and the tests being completed.
In terms of looking at persons' names, making sure they're not going to different labs, that those qualities are maintained so that we can know that the numbers are a true reflection of what's happening in country. Having said that, we do feel that the numbers have increased, as we perhaps expect them to, because we have community spread in country. We know too that more persons are also perhaps testing more frequently, because we have seen more exposures in a lot of industries.